terima kasih. Selamat malam rekan-rekan semua. Pertama-tama perkenalkan, nama saya Dimas. Kebetulan di periode kali ini diminta Pak Andi ya untuk membantu beliau sebagai Sekretaris Jenderal untuk mengurusi internal organisasi IAP sampai tahun 2022. Saya mengucapkan banyak terima kasih untuk RUBI dan juga untuk Universitas Trisakti ya atas kerjasama ini. Ini kerjasama yang luar biasa bagi kami juga di pengurus nasional IAP, karena di periode ini salah satu program unggulan IAP adalah mengembangkan kapasitas anggota-anggota IAP yang salah satunya dilakukan melalui event-event seperti ini, ya, baik training, kemudian juga diskusi-diskusi, talk show, sehingga kesempatan-kesempatan seperti ini kami sangat memberikan apresiasi yang sangat besar bagi RUBI dan juga Universitas Trisakti, sehingga kita bisa bekerja sama untuk berkumpul sekarang, saling berdiskusi, dan juga bertukar pikiran. Nah, saya kira IAP dalam kesempatan ini juga ingin mendorong ya kepada rekan-rekan semua. Nah, karena ini kerjasamanya dengan IAP, maka saya mau minta izin juga untuk mendorong rekan-rekan agar mendaftar menjadi anggota IAP untuk para praktisi ya di bidang perencanaan wilayah dan kota. Akan banyak sekali event-event seperti ini di IAP juga, event-event diskusi, training, sharing knowledge, sehingga akan memberi banyak manfaat. Nah, saya juga mengharapkan agar kerjasama ini bisa berlanjut, tidak selesai sampai di sini, sehingga ke depan event-event seperti ini bisa kita kolaborasikan lagi. Selamat berwebinar. Saya kembalikan ke moderator dan terima kasih untuk para narasumber. Terima kasih juga Pak Alpano atas kesempatannya.
Sama-sama.
Selamat malam dan selamat berdiskusi.
Juga terima kasih kepada Pak Sekjen dan IAP khususnya. Kita telah berkolaborasi bekerjasama. Terima kasih juga dari RUBI untuk IAP. Semoga program-program kolaborasi kita terus berlanjut ke depannya. Terima kasih Pak Sekjen. Jadi mohon izin Bapak Ibu, perkenankan saya membawa acara ini dalam bahasa Inggris. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Salam, Om Swastiastu, Namo Buddhaya, salam kebajikan. Good evening, everyone. Glad we can meet on a cheerful Saturday night on the virtual room for joining discussion of hashtag Bincang Kota Kita. Let's Talk Our City, Volume 5. In collaboration with Ruang Urban Indonesia, Indonesian Association of Planners, and Student Board of Faculty of Landscape Architecture and Environmental Technology, Trisakti University. With the discussion topic raised today is about post-COVID-19, a paradigm shift for urban environmental planning. First of all, I'd like to say hello, greeting to our speakers who have been present tonight, to the Honorable Dr. Seow from Malaysia, to the Honorable Dr. Ali Keyvanfar from United States, and to Honorable Dr. Galuh Syahbana Indraprahasta from Indonesia. Thank you for being here to join our program. And also, thanks to the audience, both Zoom and live streaming on YouTube, for participating in this evening webinar. Before we start to listen to the presentation from the speaker, let me give a bit highlight introduction related to the topic of discussion. COVID-19 pandemic or coronavirus has forced the urban planners to innovate and change the new paradigm of urban environmental planning that focuses on several new concepts due to social distancing, physical distancing, and work from home, which expected to remain post-COVID-19. some empirical facts today: least mobility of people, limited community interaction, increasingly high use of digital technology, and so on and so on. Then the question is whether there is a paradigm shift in urban environmental planning post-COVID-19 and how we have to respond about that. So therefore, we can listen and ask directly from the speaker who are certainly very competent and appropriate to answer these questions. Ladies and gentlemen, to shorten the times, let's we go straight to the core event that we have been waiting for, the exposure presentation and discussion, which later will have a Q&A session after the three speakers deliver their presentation. And at the same time, the audience can also ask questions through the meeting chat room by typing the question and to whom it will be addressed. Jadi mohon izin Bapak Ibu dapat mengajukan pertanyaan kepada para narasumber nantinya, dan juga dalam sesi presentasi juga bisa sambil mengajukan pertanyaan melalui grup Zoom grup chat, nanti akan kita bacakan. Dan juga terkait dengan sertifikasi nanti akan ada link daftar hadir yang akan dibagikan 15 menit sebelum acara ini berakhir. Jadi mohon untuk dapat mengisi link daftar hadir tersebut. Okay, our first speaker is Dr. Seow. Dr. Seow is an associate professor at Faculty of Technology Management and Business, Universiti Tun Hussein on Malaysia at Johor, in Johor, Batu Pahat. He has research interests and expertise in environmental management and urban development. While in the professional body experience, currently he is a committee member of Environmental Management Association of Malaysia and life member of Geography Association of Malaysia, also professional technologist at Malaysia Board of Technologies. Maybe we would like to hear from Dr. Seow, as we know that during the pandemic from March to the present, with the restriction of activities throughout the world simultaneously, the earth and the natural environment can rest for a while. The question is how we can maintain this collective awareness so that we can continue to reduce and preserve the environment from pollution. To Dr. Seow, time is yours, please.
Okay, thank you, Dr. Alpano. Yeah. Okay. Good evening to everyone here. Okay. I'm going to present a little bit. Probably not 1 hour. Maybe just 15 minutes. So how about my voice now? Is it clear, Doctor?
It's very clear. You can
okay,
start to share your PowerPoints on the screen. Okay.
Okay, here is my topic. It's about rethinking environmental management in a post-pandemic.
Can you make it full screen, Doctor?
Yeah. Okay. Yeah. I have the 20 slides here. The presentation is very simple. It consists of environmental during world lockdown, as I mentioned just now. Yeah, what's happening in the world during lockdown, the environment. So second part is a paradigm shift for environmental planning and management. Okay, as we knew, COVID-19 probably is taken us about 3 to 4 months actually, yeah, starting from the China, the lockdowns during, I think, February, end of February until now. So the whole world can consider 3 months to lock down. So these things, this lockdown period is bringing the positive and negative impact for me. The positive impact is we can look into the air quality. There's a NASA study about the nitrogen dioxide. Yeah, dioxide is a decrease in the in China during January to February. Yeah. Is Alice, Dr. Alice place, US. Yes, the study also from NASA showing that the NO2 also decreased during this period compared to previous years. Here is about the nitrogen dioxide in Italia, northern Italia also have the decrease the scenario. So it's good for our environment. Yeah, carbon emissions due to the COVID issue. Also, we cannot fly here and there, right? Cannot run. Yeah, jet cannot flying. So aviation industry is stopped at the moment. So it's a good for us, actually reduce the CO2. And then based on the second picture is about the congestions of the traffic. Yeah, we stay at home, not going out. So environment also look nice at the moment. So water quality, this is some sources from India, or Ganges River also look better. But some houses have something negative for me. Yeah, because of waste. Yeah, we increase of the medical waste. Yeah, and then we use the mask now. Nowadays, you go out, you have to wear the mask here and there, and then you can pick up the mask everywhere, actually. Yeah. Okay, new normal of the life living. We use a sanitizer, we use the plastic bag, and then we use the what? Online shopping. I do online shopping, yeah, during COVID-19 lockdown in Malaysia. I shop a lot of coffee bean, because I'm coffee lover. Okay, so this is happened in Brazil, this deforestation of the rainforest, yeah. And then poaching, okay, this happened in African, yeah. So this is something that maybe have the more and maybe have less. This is only I can conclude is a positive and negative side, yeah, on the environment. But now we're going to the post-COVID-19. So living is in a new normal after pandemic. Yeah, we're knowing nowadays we return to a daily routine work, and then we're going back to school maybe. Yeah, some of the country already start their school days. Yeah, for the kids. Yeah, like university here we still remain work from home, not university but students. Yeah, student at home, and now everything you have to wash your hand all the times, social distancing, you have to measure your temperature, and then wear mask. This is a new living after the pandemic. Yeah. The paradigm shift in environmental management, I look into the few points here I highlighted. The first is a strengthen public awareness and community preparedness. Yeah, because now the people aware about the importance of the hygiene, importance of cleanliness of the surrounding. So we take this as a challenge. We strengthen the public awareness on the cleanliness, yeah, about the importance of the safety, hygiene, and pandemic response. Yeah, especially for the community preparedness. Yeah. Secondly, I look into the enforcement. Even though this is not new, but we use this period, yeah, after post-COVID-19, we look into the better environmental quality. So, well, and then we look into the wildlife conservation aspect. So we hope that enforcement will more emphasize it, yeah, during post-COVID. So the point is about the ban on the trade in wild animals. This is terrible. I hope that now we use like this strategy. No, this issue we can ban. Try to ban and not eat. Yeah, I knew Chinese people like to eat a lot of the animals. Yeah, but now we try to reduce it. Okay, fourth is create more inclusive society. Yeah, this one is quite very related to the urban planning aspect. Yeah, is an accessible environment for persons with different disability and aging people. Number 5 is standard operational procedures for new normal living. Yeah, nowadays we go on the we go to the shopping mall. Yeah, we go to here and there. Yeah, we have to follow the SOP. Yeah, this is what happened now. Yeah, and then we work from home. Even though value of the many people workers that work from home, we look into the the stress, sure, stress like me, but they have the good impact to the environment is they reduce the root congestions, yeah, reduce carbon on air, and then they promote the better expenses. Yeah, we lacking go outside, work from home, and then we do everything. So we buy and then what we want. Yeah. The 7 is increase of food security. Yeah. During the lockdown, yeah, we can buy a lot of food. Yeah. So now we have to rethinking about the food security, the protect the most vulnerable people. Yeah. Keep global food supply chains alive. This is very important. Yeah, during lockdown, so how we can get the food again? Yeah, during this period, we have to think maybe for the 3rd wave or 5th wave of the COVID-19 will come back. So this one we have to think about. So the next is a new business. We look into the compliance with the ISO 14000. This is the opportunity for the businesses look into the to grab this this opportunity. So to the eco labeling, eco packaging, material, AI is one of the new technology now we implemented. Yeah. So for the environmental management, a lot of you use AI. Yeah. And then waste technology. Yeah, lots of waste now producers. So waste to energy, waste management system also have to look into. Yeah, like just now we highlighted about lots of the medical waste and so on. So waste technology is one point. So paradigm shift also we look into develop new technology through the research and development for better environment. Yeah, create the occupational safety and health management and risk management culture. At this moment, we have to think about it. Yeah, risk management and OSHA at the workplace. So one thing is about the human, the environment. So we look into the manage the fair, manage the stress, construction, structurations. Okay, these things happens during the COVID-19. Okay, anxiety, losses, these things. So we need stress. We need to reduce our stress. Okay, the human aspect. So at this point is to look into the paradigm shift into the increase the healthcare system capacity. Yeah, without protections measure, we can look into the blue one, the blue color curve, and then how do we can make it into the green curve? This is with the protective measures. So we need the healthcare system capacity to support it. Yeah. So lastly, I pick up this point is pandemic influenza preparedness and responses WHO guidelines documents. These documents, they divided the pandemic into the 6 phases. So I pick up the last phase, the post-pandemic period, to look into the environmental and look into the social and society aspect. So the planning, coordinating is the first point. Review lesson learned and share the experiences with the international communities. Yeah, and then we get other resources to enhance our planning and coordinating. And the second point is monitoring and assessment, evaluating the pandemic characteristic and situation monitoring and assessment tool for the next pandemic and other public health emergency. Yeah, so preparedness and monitoring. So next is about reducing the spread of the disease. Yeah, conduct evaluation of all interventions implemented. Yeah, we have to identify. Yeah, to make it to stop it. Yeah, yeah. So to reduce the spread of disease. Yeah, that's 4 point is the continuity of the healthcare provisions. Yeah. And last is the communication. Communication is most important things, yeah, to disseminate the informations, what to do for next, yeah. Without communications, without the knowledge, without the informations, we can't do anything. We can't do predictions for our environment and health planning. Yeah, so I end up here with thank you and stay safe and well. Yeah, thank you. Dr. Alpano.
Okay, thank you, Dr. Tawi, for the presentations and explanation, which is very interesting, actually. Yeah. We will continue discuss in more detail in the Q&A sessions from the audience, of course. Okay, next, I would like to invite the second speaker, Dr. Ali Keyvanfar. Dr. Ali? Hello, Dr. Ali?
Hello, yes.
Okay, can you like? Okay. Dr. Ali is an assistant professor at Department of Construction Management, Kennesaw State University, United States in Atlanta, yeah, locations, Atlanta. While in professional position, he used to work as adjunct associate professor at University Technology Malaysia, being a visiting professor at Universidad Tecnologica Equinoccial in Ecuador, being visiting scholar professorship at University of California, San Diego, and currently he serves as a leading project manager, CIFAL, I don't know how to spell CIFAL, Atlanta, under United Nations Institute of Training and Research, Kennesaw State University. Okay, maybe we would like to hear from Dr. Ali how COVID-19 can be a driver risk factor in urban development and how to rethinking in sustainable planning. To Dr. Ali Keyvanfar, time is yours, please, Dr. Ali.
Thank you very much, Alpano and everyone, to set this seminar up. I will definitely, I'm enjoying to hear from Professor Tawi and Alpano and others to learn more about what you are seeing from your angle of view. So let's start the...
you can share your PowerPoint on the screen share.
Are you seeing my screen?
Not yet.
Not yet.
Maybe, Prof. Tawi, can you turn off your share screen, please?
Yeah, okay. Yeah, I have to close it, yeah.
Okay.
Still all right?
Pak Nirwan?
Yeah. Yeah.
Okay, okay, thank you.
Okay.
Please make it full screen, Dr. Ali.
So you're seeing now?
Yes.
Okay. So do you have a full screen view now?
Yes.
Okay, that's great. So the topic today, which I will cover, would be 4 different issues on COVID-19 and urban planning. COVID-19 as a driver of modern risk factors in urban development, it would be the first topic to cover. Then, considering risk factors, we have to come up with a risk planning approach. So if we have a risk planning approach in place, what would be forwarded challenges? After that, rethinking on urban functions. So solving those challenges, we have to come up with new urban functions. So that's why the third topic is urban functions. And the last topic to cover is a kind of fellowship opportunity for those who wants to join, is under CFAL Atlanta, which is under United Nations Institute of Training and Research. I will explain it at the end of the presentation. So let's move to the next slide. I think Dr. Alpano already explained my attachment to earlier universities, so I will skip this slide, but you will have it since the PowerPoint is shared with you all. So as I said, the first topic would be COVID-19 as a driver of modern risk factors in urban development. There are 3 subtopics here. First, we have to identify and understand what is classic risk. After that, based on that understanding, we can comprehend what's the differences of modern risk with classic risk. And having these 2 conceptual understanding, then we can go to a real life example of COVID-19 and COVID-driven risks in urban planning. So talking about classic risk factors, you see classic risk factors, normally we have known and definite cause because we have been exposed to the cause earlier to this. So we know all the causes. If the cause is in our project, urban planning or urban design project, we can understand it, we can predict it. You can even so come up with probability of that cause hitting you. And also in parallel to that definite cause, normally we have some probable causes which we have to measure. So these causes, they will create a known risk factor, which you are familiar with, and the potential likelihood you can measure. At the end, the result of this risk factor will affect, potentially will affect your project objective. So we have to identify the cause, we have to identify the risk, then we have to identify which project objectives have been affected. This is very classic way of looking at risk factors. And normally these risk factors in classic risk management, they are individual and you have to look at them from cause and effect point of view. So if we have to compare that classic risk management and classic risk factors with modern risk factors, the cause is unknown. It's totally coming out of blue and you don't have any kind of prediction on the cause. Something like COVID-19 consequences to our life is totally out of blue. And the concept of these out of blue risk factors or modern risk factors started by 2009, 2008. From that time, scientists, they have been talking about modern risk factors, unknown causes, out of blue causes, and unpredictable risk causes. So anyways, you don't have any sort of preview on the cause. That is the main difference. But probable causes, are you hearing me, Dr. Alpano?
This is a little bit disturbing, but it's already controlled now.
Okay,
sorry.
thank you very much. So as a result of this unknown and known causes, we will face predictable risk factors, but also unpredictable risk factors. You might see something as a result of this predictable risk factors, you will see impact to project objectives. So impact to the project objectives is very similar with modern and classic risk factors. So now let's go to a real life scenario. One of the modern risk factors, one of the consequences of COVID-19 is a modern risk factor which we are seeing, modern cause which we are seeing, that is COVID-19 infection hesitations. Last time this infection hesitation was not there. Now we have a new cause, and that is infection hesitation. Out of this cause, we are seeing 3, it's just one example, and you have tons of other causes. But Out of this cause, we can see, for time being, we can see 3 parallel risks. Movement to decentralized area. This is one parallel risk. Another parallel risk, decreased use of public transport. Another parallel risk, decreased social carrying capacity. These type of behaviors, they are creating risk to us. And as a result of that risk, you will see some urban project objectives under influence. So these project objectives, they are currently under radar to understand what would be the effect of these risk factors on these urban planning objectives. So for example, movement to decentralized area, it will affect progressive real estate value creation, because progressive real estate value creation is one of the objectives of urban planning. Centralized transportation is one of the objectives in urban planning, and that will be affected if people, they are moving to decentralized area. Why they are moving to decentralized area? Because of COVID-19 infection hesitation. So this is how these things are connected together. By having this spectrum of risk analysis, you will easily understand what is the cause, what is the risk, what is the impact, and you can monitor the factors and influences for future actions. So we have a long list of project objectives, which they are under radar for potential influences, potential changes. But since we don't have much time, I will skip this part. If you need further information later on, I can present to you. But it's very beautiful. If you go deep on every single project objective, urban project objective, you will understand how the future is shaping. To have a more comprehensive list of risk factors, always I would suggest to download World Economic Forum. So if you have any topic in mind, just go and download this. It's a free app, World Economic Forum. It's supported mainly by European Union. If you download that app and install it, after installation, this is in the middle of this screen, you are seeing a screenshot of the app. When you open it, it will be like this. Then you can search for the terminology which you are thinking of. Say your project is about Indonesia or COVID-19 or whatever project you have. You will see a beautiful network of risk factors, and you can play with those risk factors. Sometimes you will have some voice videos around that topic. So always I would suggest to go through that. So checking for COVID-19, you will see this beautiful graph. So by that, you will find how COVID-19 is impacting travel, how is impacting trade, how is impacting urban planning, urban design, infrastructure, global governance, global health. So that will give you tons of ideas. In urban planning, urban design, urban development, always we have risk management to give us starting hints to understand how we have to design for the project and how we have to plan for the project also. Never mind, going through this app, you will learn more. So passing this part, which was understanding how COVID-19 considered as a modern risk factor, the second part of the topic here is forward challenges, three-dimensional forward challenges. If we want to understand this risk and we want to plan for this risk or mitigate this risk, we will have three different directions to go. Top down, which is governance; middle out, which is NGOs, associations, universities; bottom up, individual behaviors. So top down, normally top down counts, we can count federal or central government, a state or province government, city, regency, or county government as a top down government. the tool they have, top-down tools, normally is policies, rules, regulations. There is something good about these policies, and that is policy is very fast. If government is like imposing some policy, tomorrow morning it's a rule and you have to follow. So it's very fast, but it's holistic. It's not comprehensive because it is coming to you as a result of 1 day, 2 days, 3 days, 1 month, 6 months of discussion in the parliament or somewhere else. So there is no comprehensive research behind it. That's why I can say it's holistic, but it's not comprehensive. And always you will see modification. After a few years, you will see modifications based on claims, based on feedbacks. So if we want to solve these issues, because it's COVID-19, and COVID-19 is very dynamic, we have to solve these typical issues and go forward. So to solve those issues, we need to have policy development, not policy duplication or adaptation. Last time, which is still in practice, when you want to have a policy, normally in United States, they will go for Canada. In my region of Georgia, they will go to another state of California to learn and copy in Georgia. But nowadays, nobody has a rule, so you have to develop. So policy development is one thing. Then agile policy making procedure is another thing, which we have to be fast and adaptive in policy development. Another thing which we have to consider, which is, it's a real challenge for governments to apply, is a lean approach. Lean approach is something new in business management, but in government, we have to apply it, because without lean management, you are losing tons of money by putting forward a policy which is not hypothetically tested and validated. So the second dimension, which should be parallel with another two dimensions, is middle out, NGO and universities. Normally middle out organizations, they are universities, NGOs, association, nonprofits. These middle outs, normally they will come with guidelines, assessment models, standards. Pros, it's more effective because there is a research behind it, is a little bit more mature. Normally it comes from PPP agreements, like public-private partnerships, but it demands 20 times more investment compared to governmental approach, because in government just is a group of people which they are, based on their experience, they are coming with some rules and regulation. But in middle out approach, you have to put some money, and they have to do some research. It will take time. It will take 4 years, 5 years. So the time is like 10 times more than the normal, and investment is 20 times. So if we want to solve this problem of time and money, first we have to work on efficiency. We need efficient use of resources in research and development. Currently, we don't have. Currently, we have, even though in same department, in same university, we have 5 different professors doing same research field. And all of them now in the home, all of them, they want to help to COVID-19, but still we don't have any platform, online platform for them to work together. We have a lot of professors in Indonesia, which they want to be in a research in United States. We have a lot of professors in United States, which they want to be in a research in Indonesia, but we don't have a platform for them to collaborate. Then another thing which we can consider is aggregated focus. COVID-19 is not something to just sit down and hope for success. Everyone, whether you are in urban planning, urban design, construction, whatever, we have to refocus our research interest to touch the topic. But with this way of doing it and sitting down and expecting other people to do something, we can't solve it that soon. We have a limited resource of professors and researchers in every single field. If we have aggregated attention to the topic, maybe we can find a solution faster than expected. The third dimension to consider is bottom-up approach. Bottom-up normally is individual behaviors. PROS is very effective because from individual level, you are improving everything. But the problem is, it's 10 times or 30 times more expensive compared to other approaches, and it will take 20 times length of duration compared to other approaches. What we can do to solve these problems in this dimension? Incentivication. Incentivication is something which historically is missing. You can look at your rules and regulation. You will see if one person is doing one single bad thing, government will jail it. And the guy will go to see the consequence of that one single bad thing. But if you do one single good thing, do we have a rule and regulation and some incentivification approach to appreciate it? No. You have to do 70 years of good things. After that, maybe somebody will recognize it at your graveyard. So that is some historical problem which we have to solve. And I believe with this blockchain technology and cryptocurrency, easily we can create a platform of incentivification. Currently, I'm working in a project which we are developing a mobile app, which that mobile app is monitoring your COVID-19 adaptive behaviors and giving you coins for those adaptification, and you will earn money for that. So if somebody is sitting down home, he will generate some income, even though he's sitting down home. Why? Because it's really sitting down home is helping government, helping global community to save money, to save life. So we have to value it. We have to appreciate it. Then the next thing to consider is democratization of opportunities and democratization of risks. Unfortunately, these two also, democratization of opportunities is something which have been there for 4,000 years from the first city we had in the universe. But democratization of risk is totally new. You can see nowadays there are some rules and regulations saying that, okay, from one department of 10 people, 2 people have to come at the early of the week, 2 people in the middle of the week, another 2 people end of the week, and weekend another 2 or 3 people. So they are democratizing the risks during the department. These things that are totally new. We haven't faced those type of things earlier to this. So it's a new concept. We have to work on it. We may work on it for another 4,000 years to come up with a consensus, but it's a good thing. Something to consider is for all the 3 dimensions, whatever dimension we discussed, this is a common problem. And that problem is always we have an early adopter, those who like the idea, those who are pro-vocal, they think this is the right thing for future. We have a mainstream, which they have to see the success of that change to accept it. We have a downstream, which they have to see if the mainstream is accepting that, then they will accept. We have a laggers, which they won't accept. They will accept if they are in the hospital. So this sort of different personas is very important to consider if we are working in every single dimension. So the next topic is rethinking urban functions. This is a very quick topic. You see, what we are seeing is socialization cloud, which has been there from many years ago. From the first city we had in the universe, socialization was part of the paradigm. Now this big cloud with 4,000 years of history, being all the religions supporting this idea, all the designs supporting this idea, all the planning supporting this idea, this cloud is hitting a new cloud, and that is social distancing. So out of this conflict, we have to come as urban planner, urban designer, we have to come up with a new urban form and function. If we don't come up with a new urban form and function, we will lose our values of socialization. devaluation is something which we will see in future. We have to step forward as engineers of society, good engineers of society, to come up with this new form and function. So the last thing to cover, as I promised to you, is the fellowship. So fellowship in CFAL Atlanta under United Nations Institution of Training and Research, we are launching a fellowship. Last time it's supposed to be 3 weeks face-to-face, which you travel to here to have that training. But now it will be kind of online. It's good for like master holders and PhD holders who wants to experience one training in United Nations. So at the end of this fellowship, those who are participating, they will receive certificate of completion co-signed by United Nations Assistant Secretary General and Executive Director of CFAL Atlanta. So that's it for today. I'm not sure how long it took me, but hopefully it's on time.
Yeah, it's
so,
on time, 20 minutes, I think so. Okay.
Thank you very much. Thank you.
Thank you so much, Dr. Ali, for a very comprehensive strategy exposure and
Dr. Alpano, I think you have to unmute your mic, your voice. You have to unmute your voice first because we couldn't hear you.
Sorry. Okay, Dr. Ali, can you hear me now? Okay,
yes,
thank you. Thank you, Dr. Ali, for a very comprehensive strategy exposure. And the last one was about fellowship, offer. Is very interesting and a good opportunity. Hopefully, a lot of from Indonesian will apply that programs in the next semester. Thank you for sharing that information. It's very interesting. Let us continue with our last speaker, Dr. Galuh Syahbana Indraprahasta. Dr. Galuh is a researcher. He's working for government agency at Indonesian Institute of Science or LIPI, Lembaga Ilmu Pengetahuan Indonesia, and currently serve as head of socio-economic development and innovation studies di LIPI. Besides working at LIPI, he is also become a teaching staff at Division of Regional Development and Planning at Institut Pertanian Bogor, IPB. In the professional body, Dr. Galuh just been appointed as Vice Chair of Social Development Division at National Board of Indonesian Association of Planners, IAP. Tonight, maybe we would like to hear from Dr. Galuh, urban planning perspective, reflection of post-pandemic COVID. Is there any urban problem and how we as a planner have to react with that? So to the Dr. Galuh, please, time is yours.
Okay, thank you so much, Dr. Alpano, distinguished speakers, all the participants. A very good evening. Wait, I think I have to share first my slide. Okay, wait a moment. Okay, the topic that I will cover today is about urban and regional planning, Indonesia, post-COVID-19 reflection. Although I focus my my presentation in Indonesia, but I believe that it could be extrapolated to the context of also cities in developing countries, because there are common things that also similar between large cities in Indonesia and also in other developing countries. But before discussing the details about urban problems and also challenges for urban planning in Indonesia, allow me to give some context of urbanization in developing countries and also Indonesia, because I think it's important to provide it first. As you may have noticed that if you talk about cities in Indonesia and also in developing countries, we also have to know about the phenomenon of urbanization, particularly rapid urbanization. Different compared to, for instance, cities and also the pace of urbanization in developed countries, which actually already highly urbanized and quite stable in terms of urban population growth. Urbanization in many developing countries, particularly here I speak about middle-income countries and also low-income countries, is still very, very high, in particularly most striking for low-income countries. For instance, you can also see on this graph that most of these countries are less urbanized in low-income countries. For instance, less than 35% of the populations living in urban areas for the low-income countries. And for the middle-income countries, around 50% of the total populations are living in the urban areas. And for these countries, urbanization is still a very, very popular trend, and particularly for the low-income countries. You can see on this the trend over the last 6 decades that actually the growth rate of urbanization or urban population growth in these countries has been quite stable at around 4%. And also the growth rate in the middle-income countries is also could be considered relatively quite high, for instance, compared to the world average. And this is, of course, very, very different compared to the cities in developed countries or high-income countries. And the similar figure can also be seen in the context of Indonesia. You can see here how urban population growth in Indonesia over the last 6 decades. And now Indonesia is around more or less 50% of urban population. And here in terms of Indonesia, I would like to provide more details. For me, it's very interesting because if you see the figure on the right side, this is about the figure of the percentage of people living in major metropolitan areas in Indonesia or the largest cities in Indonesia. We can see here actually around half of urban population in Indonesia is living in these 7 major metropolitan areas. So it's very interesting that these largest cities in Indonesia has low share of urban population. And this is also become my background of, or my focus of this presentation today. When I'm speaking about urban planning or cities problem in Asia, I emphasize on problems in large cities because, you know, around half of the urban population clustered or centered in these largest cities. And if we go into more details, when we then dig further into the 7 major metropolitan areas in Indonesia, we could easily see that actually it is the Jakarta metropolitan area which has been a very, very dominant large cities in Indonesia. Yeah, although we can also, we should also admit that the other large cities in Indonesia or the other major metropolitan areas in Indonesia, such as Surabaya, Bandung, Semarang, Medan, Makassar, and Pasar, have also a very large proportion of the Indonesian population, but you can look at the trend. It's very striking that the proportion of population living in Jakarta metropolitan area has increased continuously, yeah, from 6% in the 1960s to around 12% of total Indonesian populations in 2010. So there's been a continuous dominance of Jakarta metropolitan area as the largest city, or as primate city, we could say that way, using that specific term, in the urban system of Indonesia. And the other interesting thing that I would like to share to you that is also that these large cities are mostly located in Java, the most populated island in Indonesia. So actually this also representing Java's dominance in terms of population and also economy. And there are also a trend on urban agglomerations formation between Jakarta and Bandung. Based on that specific context, we could understand that in developing countries in general, and also in Indonesia in particular, there is the pace of population growth or urbanization growth is very high. We have to admit that it has created multiple challenges in terms of urban development and also planning. But also, we have also to note that this kind of rapid urbanization has not been followed by the rapid increasing institutional capacity and also the quality of planning and policies in delivering public services. So the unbalanced speed of urbanization and the increasing quality of our institutional setting and also policy has created multiple urban problems. Here, I would like to focus on one certain specific issue that I assume it's very important in the context of Indonesia and also in developing countries in general. That is that the pandemic has actually exposed multiple urban problems generated by inequality within those large cities. So here I focus on what are the implications of this inequality and what has the pandemic done in exposing these problems generated by this inequality. There are a couple of issues that I would like to raise. There are a lot of issues, but I just would like to raise a couple of issues. The first one is, of course, about physical distancing. It's a very popular term, or social distancing, some may say that way. It's a very popular term, and it seems very, very easy to say or to speak about, but it's actually not very easy to be implemented. And in particular in developing countries and also Indonesia. Why is that? If we talk about inequality and if we talk about space, we have to admit that there's a kind of fragmented space. Here I divide it into simply fragmented economic spaces and also fragmented social spaces that has some implication or consequences to policy-making process. That is, if we would like to impose a kind of physical distancing policy and also lockdown policy, the policy could not be one size fits all, because there is different kind of urban fragmentation within the city in terms of social and economy. For instance, in terms of economic space, we can see that this kind of policy could be relatively easily imposed in modern shopping malls, for instance. But it's very, very difficult to be imposed in traditional markets and also in the context of street vendors. There are people who have to work on daily check, and there are sellers who want to buy something which are considered cheaper. So physical distancing could not be strictly imposed in this respect. The other thing is about social space. Here I provide an example about housing. It's very easy for people living in decent houses to do multiple activities and also including exercise, like this woman here. But there are also people living in tiny houses and cramped dormitories, which could feel very, very stressful inside the houses. There are no many things. The room is quite tiny. There are no many things that they can do that, and also they are more vulnerable in terms of physical interactions because there is no much space to be isolated. So if you heard about the news in Singapore a couple months ago, and we know that Singapore is one of the best example how to manage and dealing with this kind of pandemic. There was an outbreak caused by or centered in the housings, the migrant housings, which is also categorized as cramped dormitories. So in the case of developed countries, such kind of dormitories are also troublesome for them. So it's very obvious for Indonesia as well. You can see here, this is Jakarta, this is the city center, and this is the crowded dormitories. The second thing is also, if we talk about cities, we also have to look at the public transportation. In the context of large cities such as Jakarta metropolitan area, commuting could be considered as habitus. But one striking problem is actually for citizens having no cars. They have no other choices to do their mobility, while at the same moment they have to work. Yeah. No, not all the people can do their work at home. Some of the people have to do their physical jobs, like for instance, this low income and also medium income people, and they have no other choice instead by using this transportation. Here you can see inside the commuter line in Jabodetabek, they are wearing masks, but there is no physical distancing because they have no choices. They have no cars, and if they use their bikes, it's too far, yeah, really far. The other thing is about our understanding of urban or urbanity. If we talk about urbanity, we actually talk about density. But in the case of developing countries, including Indonesia, there are at least two different density. The first one is managed density, as we could easily, for instance, observe in many cases in developed countries. But there's also a lot of disorganized density. While managed density could be easily managed, this density should be considered as something which need more attention in terms of how they could, for instance, access to core services in amidst this pandemic, for instance, access to the health facilities and also access to the clean water, for instance. Indonesia, for instance, Puskesmas or the community health center in each sub-district is very popular health facility provided by the government. But you have also to notice that although these Puskesmas are spatially unequally distributed, but the quality is not the same. So although physically they are health facilities, but not all the things that should be provided there could be accessed. And that also create another problem for the vulnerable people. The other thing that I also find very important here in the context of Indonesia is social aid distribution. You may also notice, particularly our colleagues from Indonesia, that because of this pandemic, many people have lost their jobs. So the government has launched a kind of policy to help them by distribute so-called bansos or social aid. But the problem is the government doesn't have reliable data whom they should distribute that social aid. And I think this is also a very challenging task for urban planning because in many aspects and in the mainstream perspective, urban planning is seen more as physical planning. But actually, we have to move our perspective of urban planning not only as physical planning. We have to see city as also a social economic construct. If we hear about just city, it means that city have to be provide a fair environment for all groups of people, including the vulnerable people. And this pandemic actually has exposed the data-driven policy in Indonesia, and also how we see city more than as physical planning. And based on those issues and problems, I think there are a couple of things that we could consider to move forward or to shift our paradigm in terms of urban development and planning. The first one is, I think planners and also the government should consider how to build or to develop multifunctional urban spaces. For instance, multifunctional buildings and also multifunctional green open spaces. This is a very best example of multifunctional buildings. It was used as the athletes' dormitory during the 2018 Asian Games, but now it's being used as the temporary hospitals. So I think many local governments and also planners have to think about this kind of buildings to prevent or to be prepared with the forthcoming pandemic. The other thing is about multifunctional green open spaces. We know that green open spaces could provide a healthier environment, but also in terms of or in the condition of pandemic, it could be also used for other purposes. For instance, for urban farming. You know that the pandemic has also exposed a new problem about food security, and it's also a very good idea to closer the distance or to closer the access of food production and supply. The second thing that we have to rethink in the context of Indonesia and also in developing countries is how we can use data, reliable data, how we should use reliable data, or how should we make or develop our policy and our urban planning based on reliable data. So there is a need a kind of to to have that kind of building kind of territorial information system, building a big data, and probably using the terms of smart city in general. The third one is about density management. As we know that the term urbanity and urban is very close to density, but we have also to manage it. The first one is about how we could rethink about develop affordable and also decent housings. And the second one is about to develop public spaces, because it's okay if you have tiny houses, but you have to be able to access public spaces because for health issue. Yeah. The fourth one is decentralization of services. We know that not all the big hospitals can, for instance, facilitate all the patients. So the government could also revitalize the role of, for instance, puskesmas or the community public service. The second one is related to the database policy making. That is how the kelurahan or the sub-district office could be also digitally connected, so that policy measures could be also decentralized, and also with using reliable data which is updated daily or weekly. And the last one is more general. How we also have to think about creating more integrated urban regional planning by considering several networks like transportation networks, food production, energy, and many things, because the globalization is also very striking here in the context of pandemic. So probably we have to plan our food within our area. The second one is about integration between physical planning and social planning, because urban planning mostly seen as more as physical planning, but in the context of developing countries where inequality issue is very striking, I think it's very important also to have knowledge about society, socioeconomic characteristic of city. The third one is about how we deal about or how we should renew our transportation system, I think we have to rethink also the Indonesian urban transportation system based on angkot, because angkot is not that sustainable. There is very difficult to have that kind of physical distancing inside angkot. It's very small, different compared to buses in other cities, for instance. And also, I think we have to reformulating policy for ojol or motorbike ride sharing like Gojek and also Grabs. And the fourth one is also very important because we have also to use planning not as only as a document as a guideline for your policy, spatial policy, but also planning as a communicative actions. Because in Indonesian context, you can also easily see that there are a lot of people who do not fully understand about the danger of this pandemic. So there should be people who have to actively communicate about this kind of issue, so that they could cooperate better with and comply with the national and also local policy, for instance, related to physical distancing, using your mask, and also lockdown or other terms. The other shift that I probably also think and suggest, and for me is quite radical, that is post-Urubia. What I mean about that one is that probably there is also worth noting that we could also reshifting our country's urbanization trend. We know that 50% of Indonesian population live in urban areas, but could we stop or slow that trend? Because probably we have to let all those large cities to take a breath at first. So how to control the rapid pace of urbanization in major metropolis by developing or strengthening smaller or medium-sized cities, and also strengthening rural areas as growth centers by creating more economic opportunities and better basic services in those areas, in rural areas, in small and medium-sized cities. And also one important thing that is also has been a growing phenomenon across the world is also digital nomads phenomenon. That is that people could work from remote areas and use the digital infrastructure to deliver your work. So I think it's also very possible that more and more people can work everywhere in the world, including everywhere across the country, Indonesia. I think I end up here, and thank you so much.
Thank you so much, Dr. Galuh, for a very informative presentation and also very interesting. Thank you. So, okay, 3 speakers have delivered their materials, and then we are coming up to Q&A sessions. Actually, there are a lot of questions coming in through meeting chat forum. Due to time constraints, so sorry, I will choose only a few questions to be read to the speakers. Let me choose some of questions. And I will deliver to the speakers. Dr. Setawi? Dr. Setawi, are you still available?
I'm here.
Okay,
Yes.
there is a questions coming from Dr. Agung Sunusi. Dr. Agung Sunusi in Jakarta.
Okay.
Concrete steps taken by Malaysia in maintaining sustainable agriculture development, especially in maintaining food availability during the COVID-19 period. So maybe he's asking about how Malaysia maintains sustainable agriculture during the COVID-19.
Okay.
And
Is it about
yeah,
the food security?
sustainable agriculture development. How maintaining food available during the COVID-19 period.
Yeah.
Malaysia, study case in Malaysia. And then the second one is from Bapak David Simatupang. Question to Mr. Tawi. as you said, that environment is healing or be better now on, but also we have problem with the medical stress. So you give some opinion or argument of the negative impact of the medic stress, especially cause distress for medicines. I think it's dangerous. Yeah, it's about the medical stress.
Okay.
And the last one is from Nadi Putri Utami. As Indonesian is an archipelago country, we have a bigger challenge to handle food security. I think it's relevant to the with the Dr. Agung Sunusi questions.
Yeah.
Food security issue during COVID-19, as each and every province has its own food dependency from other areas. Meanwhile, the transportation system itself is limited. Would you share some key solution to tackle this issue? It's a very good question, actually.
Yeah.
Maybe, yeah, this one is Indonesia case, and the first one, Dr. Agung, in Malaysia case. Maybe you can answer and respond this question,
Okay.
please.
Okay. Thank you. Okay. Can I answer now?
Yes, please.
Yeah. Okay. About the first questions, I think first question and third question is quite similar. It's about the food security.
Yeah.
During the COVID pandemic and everything locked down, Malaysia food farmer actually they face the problem like Indonesia. Yeah, like we do have the Camera Highland, and then the farmer is a vegetable farmer, a fruit farmer. And then we have the like also durian, okay, durian farmer, and then other farmers, okay, and then we also have the fishermen, okay. We have faced the food security during the starting point, the first phase, the 2 weeks. They have to destroy their food, yeah, as a fresh, and then they have to destroy it because due to the transportation problem. After that, we create and then have the group of the politician, have a group of NGO. They help them to create the website. They sell it online. So they can sell it like Lazada, online Lazada, we can get a fresh food within 2 days or 3 days. I think this is a good examples that we may use for the next. Or nowadays we still can purchase the food from Lazada with the fresh food. Yeah, this one I think is the one of the business opportunity. Yeah, can use it in either in Indonesia or in Malaysia. Okay, for the other questions about the mask, surgery mask, and then the medical waste is considered as a hazard waste in Malaysia. We do have the proper management of the medical waste. We do have the incinerator to burn all the medical waste in the one place in Malaysia. So as like we normally use the mask. Yeah, luckily I have the mask in my bag here now. This mask we use it. It considered hazardous after. One time we use consider hazardous. So once we use it, we have to wrap it from the back. Yeah, here is the go to our one, and then here is the exposed to the outside. We have to wrap it, and then we arrive home or before arrive home, we just throw it. Yeah, this is the way we throw. You have to practice. Yeah, this is our own. We practice it, and then we throw it into the plastic bag. Okay, I think I answer the questions. I hope that yeah.
Yeah, thank you so much for
Okay,
your response. And then we are moving to the Dr. Ali. Dr. Ali, still available?
Yep.
Okay. I also have 3 questions from you. Please respond in quick, a little bit quick. First from Nadia Putri Utami. She's asking about, in one of your slides, there is a graph regarding COVID-19 related issues or impact, and it stated that systemic racism is one of the impact or issue related to COVID-19. Would you please elaborate more on that topic and whether it would impact the urban planning or development? And the second one from Nadia Maulidah Ismadiani, asking to Dr. Ali, can you explain more about the new urban form in detail? Maybe you can give us the example of new urban form concept so that we can apply in our country, Indonesia. Maybe the last question is coming from, I think I can take from Nur Fitriah Andriani. In urban planning or urban development sector, what we government and NGO especially can do to anticipate kind of pandemic like COVID-19 if it will be happen in the future? Can we create some policy or something as an anticipation strategy if it will happen again? Please give some recommendation. Okay, please respond this question, Dr. Ali.
Yes, so on the first question, in fact, I couldn't find the place which the audience is talking about. So I will go back to the slide to share my screen, then you will see. So I believe the audience is talking about this graph, and the only thing here is like chasm. You see, this book is not talking about racism, it's talking about chasm. That chasm is, you see, early adopters, their psychology is totally different from mainstream, downstream, and laggers. Early adopters, they are provocal, they like change, they like new things, and they will go and walk around and they will tell everyone that is happening, that's a beautiful thing is happening. So their psychology is totally different from others. So that's why when you venture to early adopters, you are very successful. When you finish that venture and you want to venture mainstream and downstream and laggers, you will stop. So that's why the scientists, they call it chasm, a chasm. So chasm is that valley which is between early adopter success and mainstream and downstream and lagger success. Normally we count them as a 2 to 3% of the community. For every single new technology, is valid for every single new technology, new policy, new planning, whatever tools, mobile application. For example, when we had the introduction of cell phones, smart cell phones, we had this problem. We had early adopters and we had our grandpa and grandma as a lagger, which you have to buy for them the phone to use. So that is that slide. So the next question was, the next question was, I think, with regards to this slide. And I'm hoping by these answers, I'm fulfilling all the questions. I'm not sure whether the person who is asking is satisfied with my reply or not. We can continue that conversation. I've posted a link for you to fill, and you can submit back to me. The link is in the chat box. So the second question was with regards to this one. You see, the idea here is conceptually we need a new form. But that new form, you have to design a hypothetical construct. You have to design we call it a kind of mock planning. We call it MVP, minimum viable product. That MVP, you have to test it in your region, in your place, to validate all your hypothetical construct, and to improve one hypothesis to say specific features are good, specific features are bad. It's not suggested, because the question is asking, can you suggest something which we can duplicate in our region? No. The answer is no. Nothing you can duplicate in your region. You have to come up with the MVP, you have to test it, there is a lean approach, and there are tons of books around it. So you can learn reading those books. Also in our fellowship, we are talking about that. So the third question was asking about...
Dr. Ali, I think we got reply from Nadia Putri. Can you back to your first, your previous slide? She was asking but please slide up your presentation. I think it's on earlier slide. It's not great, but more like a picture. of thinking map. Can you find it? I think about that.
This one?
Maybe, I'm not sure. Slide 10, she said.
It's slide 10.
Okay.
This is slide 10?
Yes, I think so.
Well, this one is totally from the forum, the World Economic Forum. So here it's it's not easy to read. Never mind. I have to find it out. So, well, I'm not seeing, because you see the blue network is network of COVID-19. The blue network, which I highlighted, is impact on financial market. That is the one I highlighted. So I'm not seeing racism around. Yeah. But maybe because of the implication of the movement in the United States, currently we have a movement in the United States against racism and everything. Maybe that implication is bringing that question. You see, if we go to this slide, decreased social carrying capacity is something out of COVID-19, is affected by COVID-19 infection hesitation. So social carrying capacity is decreased by psychology and economically also, because people, they are losing their savings. So as a result of that, social satisfaction, because that is a risk. When you have a decreased social carrying capacity, social satisfaction will be different. Social value creation will be different. They are devaluating all the social values they had. And we are devaluating also. We are saying that social distancing is more valuable compared to last time. Just last year, we was saying that socialism and modern urbanism, compact urbanism, all of that, last year we are supporting that. But now we are not supporting those. We are saying social distancing. But anyways, there is tons of discussion in the middle. Social declassification is another thing. You see, always we are asking for social declassification. We don't want a social class driven by urban planning, urban design. But now, because of COVID-19, that social classification, social declassification is failing, and we are seeing new social classifications. Those who have money and they can stay at home and they can stay out of the society and they can be safe. Those who don't have money, those who don't want, those who are not working for government with the back support, and they have to go to the work even they are sick or even they don't have any PPE in their hand. So social declassification is failing, unfortunately. So there are tons of other examples around it. So even though I couldn't find that racism which the audience is talking about, but I think it's around this topic, and by having these comments, I think I addressed the response.
Okay. Have you answered the third question also?
So could you repeat it, because I lost?
Yeah. In urban planning or urban development sector, what we government and NGO especially can do to anticipate kind of pandemic like COVID-19 if it will be happen in the future? Can we create some policy to anticipate and strategy? Yeah, that's all.
Well, COVID-19 has been predicted. So now in the risk management body of knowledge, there are tons of discussions saying that COVID-19 is not a modern risk factor because it has been predicted. But what we are saying on the other side, we are saying that yes, COVID-19 has been predicted, but the consequence of it was not predicted. So the cause, like COVID-19 infection hesitation, for example, social distancing, for example, those things, we never predicted these things. But yes, COVID-19 has been predicted. But if to reply to that question, yes, we have some policies, we have strategies, but they are different. When you go from one government to another government, from one state, from one province to another province, they are different. What we can do to predict that these challenges which I put forward, those challenges will help us a lot. practically, there is a challenge to have a policy development. There is a challenge to have an agile policy making procedure. There is a challenge to have a lean approach to policy development. So these challenges are there, but if we can, you know, successfully pass these challenges and come up with policy development, real policy development, agile policy making, or lean approach, then we would be successful. Hopefully I replied to the audience and the question. Yeah.
Okay, thank you so much, Dr. Ali,
Sure.
for your time. And we're moving up to Dr. Galuh. So many questions to Dr. Galuh, so I'm sorry, I will pick up just 3 questions. Please, my apologize. I think I can choose one question from Putri dari Dinas Tata Ruang Provinsi Jawa Tengah ya. Can the concept of providing open space be an alternative that can be used during an outbreak like currently now happening, and during the new normal period because of the trends in the pandemic and working time condition, that working from home makes most people become boring and stressful? That's the first question, Dr. Galuh. And the second one, I can take from Fajar Tejo Krishna, from a student from Universitas Krishna Dwi Payana. At present, a vaccine that can treat coronavirus has not been found, and it is feared that this epidemic will continue to exist and spread. Related to the urban and spatial planning, does it need to have a special urban spatial design to reduce spread of coronavirus during the new normal times? I think it's related to the first one's question. Yeah. And the third one, I can check from Armeira Pudin. Question to Dr. Galuh: how long can we shift the planning paradigm? If this pandemic ends and everything is normal, will the paradigm return to the way it was before, or there will be hybrid paradigms? Please, time is yours to answer, Dr. Galuh.
Thank you so much, Dr. Alpano. I'm going to try to answer one by one. The first one is about green open space. I think I already addressed it in my presentation, that I emphasize the importance of having that kind of open space, not only in the context of a city, but also in the context of how to manage density. So if we talk about density management, we do not only discuss about the development of, for instance, decent and affordable housing, but also how to create nearby open spaces. The second one is, I think, the question from Mas Fajar. I think that this one also has been addressed in my presentations. It's about, yeah, I just would like to give simple 2 points in seeing cities in terms of this pandemic. The first one is seeing city as places and seeing city as networks. So in terms of places, I could divide into social and economic places, like social in housings and our dormitories, and economic spaces we could, for instance, see through the lens of, for instance, shopping malls, markets, our working environment. And as long as I understand, the most vulnerable groups in these economic spaces are the low-income people, yeah, because of density and crowded places. Also the social spaces. And in terms of networks, it also very important how to develop more, decent public transportations. We cannot rely anymore based on our traditional transport system like angkot and other things. And about the last questions, it's a very, very, of course, very, very deep questions. Let me give first of all a very simple questions. It could not only be solved through the lens of urban planning or urban policy. There should be a kind of also development policy. The first one is about urban planning. I think we should emphasize more, or we should practice more on the concept of cognitive planning. So planning is not only a document, but how we should communicate about something in our city. The second one is about development policy. I think it is related to how we could, for instance, make our citizens more educated and also literate. And I think that is a rather mid and long-term process. So shifting a paradigm, first of all, is not only about urban planning, it's a combination of urban plannings and other development policy. In the long term, there is development policy related to, for instance, education and literacy. And in the short term, I think it's also good to take Singapore as a very good example, that is law enforcement. So educating people, making people more literate is a very mid-term and long-term process. But how they could, for instance, comply to the policy, please show the people that the law is strong. And the last one that I think is very important is about the lesson learned that we can take from South Korea dealing with this kind of pandemic. Because Korea is now considered as a very successful story, but 5 years ago, during the March 2015 pandemic, Korea was considered as relatively failure. And the important thing is that there was a lack of trust. There is a lack of trust of the people towards the government. Because of what? Because of two things. The first one is transparency. The second one is about data-driven policy. So the important thing now is how to collaborate between different stakeholders and how to collaborate between, for instance, government and the people. That is how to make your policy, or including urban policy, is based on reliable data. The second one is how to use that kind of reliable data to make a good policy, and then you communicate with all the stakeholders and also the people, so that the government can gain more trust, and then they can easily collaborate with the citizens. I think in short.
Okay, thank you so much, Dr. Galuh, for your response. It's very interesting. And finally, I think we have come to end of the event. I thank to the speakers have delivered the material and answering questions from the audience in extraordinary way. Big applause to our speakers tonight. Ladies and gentlemen, that's all our program tonight. Before we close this seasons, I will try to summarize of our discussion. Dr. Tawi focused on paradigm shift in environmental management, strengthening public awareness and community preparedness, ban on the trade in wild animals, create more inclusive society, SOP for new normal living, increase food security. I think that's the question was coming to you related to food security. And Dr. Ali said that COVID-19 as a driver of a modern risk factor in urban development need rethinking on urban functions. Yeah, it's very interesting with the diagrams. And Dr. Galuh mentioned about radical shift of post-urbia in the last statement is very interesting. Reshifting the country urbanization trend with refocusing on small and medium-sized cities development, re-strengthening rural area as growth center, creating more economic opportunities, and rebalancing Indonesia's national development. Is very nice presentation. Thank you. Well, before closing, I would like to thank you once again to the speakers who have given us a lot of informations, and also thanks to audience for participating in this webinar. Dan mohon Bapak Ibu peserta agar dapat mengisi link daftar hadir yang udah dibagikan di grup chat untuk sertifikasi, dan nanti paparan materi akan kita kirim ke email yang telah terdaftar di link yang telah kita bagikan. Last but not least, terima kasih juga kepada pengurus nasional Ikatan Ahli Perencanaan Indonesia (IAP) dan rekan-rekan mahasiswa BEM FALTL Universitas Trisakti. Pak Nirwan, terima kasih banyak menjadi fasilitator. Pak Nirwan, still available? Pak Nirwan?
Ya, siap.
Terima kasih banyak Pak Nirwan for wonderful collaboration. Semoga program-program kolaborasi berikutnya juga dapat berlanjut ke depan ya Pak Nirwan, dan mungkin juga dari IAP juga bisa berkolaborasi seterusnya. Baiklah, sesi demi sesi dalam webinar kali ini telah kita lewati. Finally, I'm Alpano Priyandes as moderator, mohon undur diri. Insya Allah, hopefully we will meet again in another event of hashtag Bincang Kota Kita. Terima kasih, thank you all, good night, thank you, terima kasih.
You.
Ya, terima kasih untuk